Measles cases across the country are rising sharply. Nearly 200 cases have been reported in the northwest, Mpumalanga, Limpopo and Gauteng. Most of the cases are from children between the ages of 5 and 9. Muriel Mafico from Unicef SA joins us live from Pretoria to discuss this further. Hi Muriel, and thanks for joining me today. Can you tell us what's causing the current measles outbreak across the country?
We have witnessed an outbreak that has been happening since October in South Africa, starting with Limpopo, as you mentioned. And right now we're actually talking about 5 provinces that have declared an outbreak. So the Free State was the latest province to join the number of provinces that have already declared an outbreak in South Africa. The causes for the outbreak are multiple, but I think we can look at the consistently low coverage or reach when it comes to some of the routine vaccinations. In South Africa, for instance, we have children, almost 100,000, that have not been vaccinated against these life-threatening vaccine-preventable diseases. So we are deeply, deeply concerned that we need to make sure children are fully vaccinated, they are fully protected, otherwise the outbreaks will continue.
Absolutely. Those numbers are really alarming. In terms of the numbers, though, specifically, what are we looking at in terms of infections?
Currently, we are looking at over 200 cases, as you mentioned, the majority of them affecting children between the ages of 5 and 9. In fact, about 44% of the cases that have been confirmed are within that age range. Then we also have about 28% constituting children between the ages of 1 and 4. And then the remainder of the cases actually constitutes people or young people between the ages of 10 going right up to adults. I think the oldest age that we have received is around 42. So the bulk of the cases are under the age of 9.
So you've mentioned that this obviously is very much because of people or children not being immunized or vaccinated in time. For parents who haven't done this, is it too late to do it now?
Oh no, it is never too late. In fact, the message we are sharing with parents, with caregivers, with everybody, is that it is not too late. If your child has not been vaccinated, take them to your nearest clinic, to your nearest health facility. We are also urging parents to make sure that they utilize or they use the Road to Health booklet. This is a booklet which they are given at the first injection or vaccination that their child receives at birth. It helps the parents to monitor. It helps them to know which vaccines their child is supposed to receive. So we are really calling on parents to make sure that they are familiar and they have their Road to Health card. And if they are in doubt, they should go to their health facility.
Muriel, finally, I have to ask, for parents who don't know, what are some of the symptoms that they need to keep an eye out for?
There are several symptoms that they can check. First of all, it's the rash on the skin, red blotches on the skin. It is runny nose as well as high fever. Those are some of the symptoms that parents can look out for in their children.
Thanks so much for joining me today. That was Muriel Mafico from Unicef SA on the measles outbreak currently across the country.